Good morning, ladies and gentlemen. Welcome to week 8 of this course on physical medicine and rehabilitation in sports. This is lecture 2, and I am Colonel Dr. Anup Krishnan. Today, we will be discussing something about designing a sports specific injury prevention program. I'll be talking about this topic as per the following outline: introduction, objectives, epidemiology and biomechanics, risk factors and screening, design strategies, challenges and advances, and conclusion. There is a very specific role and significance of sports specific injury prevention programs. You cannot have an injury prevention program which is common to all sports. Suppose you have a sports academy, you have different children, different people of different age groups playing different sports. You cannot have one injury prevention program for all of them. Injury prevention programs have a role in reducing injury risk and in enhancing athlete performance. We must be aware of the fundamental principles which guide injury prevention strategies. The objectives: to understand the fundamental principles of injury prevention, to identify the specific risk factors associated with different sports, to develop tailored injury prevention programs based upon the demands of the sport, and to implement evidence based strategies to enhance athlete safety and longevity. Epidemiology of sports injuries. We must be aware of the different injuries which are possible in different sports, and different sports have some injuries which are peculiar to it and which are commonly seen in those events. For example, ACL tears in soccer, stress fractures in running, and shoulder injuries in swimming and gymnastics. We must do a proper analysis of the injury incidence rates, the severity, and the patterns across the age groups and competition levels. And this will help us to develop a proper strategy. We must be aware about the importance of injury data tracking for developing proper prevention strategies. Understanding sports specific biomechanics. Two-dimensional motion analysis, three-dimensional motion analysis, all these are very important for, firstly, for technique correction, secondly, for injury prevention. We must be aware about the biomechanical demands in various sports, such as running mechanics in sprinters and landing mechanics in basketball, because improper biomechanics will contribute to injury risk. We have discussed this risk factors in different sports, the intrinsic risk factors such as age, gender, previous injuries, strength, flexibility, neuromuscular control, etc. The extrinsic risk factors such as playing surface, equipment, training volume, environmental conditions, etc. And there is something called predisposed individual and there's something called inciting event. We have already discussed this in previous lectures. And a combination of these factors increases injury susceptibility. Screening and assessment protocols. Functional movement screening is the beginning of the pre-participation physical evaluation to assess movement efficiency, to identify muscular imbalances and any joint restrictions. Pre-participation physical evaluation and injury history assessment should be mandatory for all sports persons. Warm-up strategies. Dynamic and static stretching before activity. Dynamic stretching is generally done before activity. Static stretching is generally done after activity. We must have a specific activation drill which is specific to each sport. And warm-up routines should be tailored to different sports. For example, FIFA 11 Plus is a good warm-up routine for football. Similarly, you can develop or there may be already available pre-warm-up routines online. Strength and conditioning for injury prevention. We do know that strength and conditioning is required for training to develop motor qualities. But there is also the importance of sport specific strength training programs in injury prevention. We must judiciously use plyometrics, resistance training, and neuromuscular conditioning in the pre training program. Injury prevention exercises such as Nordic hamstring curls, single leg squats, etc., should be used properly. Flexibility and mobility training. There is a very strong correlation between flexibility and mobility and injuries. So, we must be aware about the impact of flexibility and mobility on reducing strain on joints and muscles. We must be aware about the differences between static stretching, dynamic stretching, and proprioceptive neuromuscular facilitation. These are different types of stretching techniques, and each have got different implications in different scenarios. We must design proper sport specific mobility drills and techniques. Load management and recovery. There is a concept of acute to chronic workload ratio, and it has a strong impact on injury prevention. We will be discussing this in a subsequent lecture. There are different strategies which should be followed for preventing overuse injuries. For example, proper periodization of the training load, proper periodization of nutrition, proper periodization of recovery, and deload weeks, etc. We should use monitoring tools like GPS trackers and heart rate variability to get a comprehensive picture about our athlete and what his metabolic and psychological state is. Technique and skill development. If you have a good technique, if you have proper skills for playing your sport, you will have reduced injuries. So, there is a strong correlation between proper technique and reduction in injury risk. We must have sport specific drills to reinforce the correct biomechanics of the sport. And we must not forget the importance of coaching and feedback in technique refinement. Nutrition and hydration. There is a strong impact of macronutrients and micronutrients on injury prevention and recovery. Hydration is very important for muscle function and for prevention of cramps. And anti inflammatory foods and supplements are used to support tissue repair. We must be aware of a concept of nutritional periodization, which helps us to prevent injuries. Psychological aspects. There is a relationship between mental stress, fatigue, and injury risk. Strategies such as mindfulness, visualization, and goal setting to enhance focus and resilience should be used. And there is a strong role of sports psychology in athlete education and injury recovery. Sleep. Very important. The role of sleep deprivation is very high in increasing injury risk. And we must practice sleep hygiene strategies for optimizing recovery. For example, stopping the use of mobile phones after 9 p.m., stopping the use of blue screens, increasing the use of warm milk, tryptophan drinks, etc. etc. These are all sleep hygiene strategies for improving sleep and for optimizing recovery. Impact of sleep on reaction time, cognitive function, and muscle repair is well known. Protective equipment. Proper protective equipment is required. For example, helmets, mouth guards, shin guards, knee braces, etc. And nowadays, the concept is tailor-made protective equipment. There have been very large advances in injury prevention by use of proper equipment technology. And Regular maintenance and proper use of protective gear is mandatory. Playing surfaces. If you're playing on a synthetic surface, if you're playing on a natural surface, there are differences in injury risk. Environmental factors like temperature, humidity, altitude, cold, heat, etc., play a large role in injury prevention and should be factored into your injury prevention program. And make sure that the field of play or the court is maintained properly to reduce hazards. Prevention of overuse injuries. Common overuse injuries are tendinitis, stress fracture, shin splints, etc. We must have strategies for modifying training loads and recovery periods. We can play around with training loads and recovery periods to prevent overuse injuries. And learn about movement variation and cross training so that you can prevent overuse injuries. ACL injury prevention protocols. Common ACL injury prevention. We must be aware of the common ACL injury mechanisms and risk factors. Preventive neuromuscular training programs such as FIFA 11 Plus and PEP programs should be practiced as per your particular sport. And there is an importance of strength, agility, and proprioception training in ACL injury prevention programs and should be started well before the season starts. Concussion prevention strategies. Concussion risks and symptoms should be told to the athletes and the coaches, and proper education should be given about how to diagnose and how to give first aid in these cases. We must teach our athletes proper techniques in contact sports to reduce head injuries. And there is a role of baseline concussion testing, such as SCAT 6, so that we can evaluate the severity or the presence of sports concussion in an athlete. Return to protocols must be rigidly followed for concussion prevention. Recovery modalities. Using cryotherapy, compression therapy, active recovery techniques, massage, hydrotherapy, contrast therapy, all these are good tools for improving muscle recovery. We must have a proper periodized program for recovery also, and we must have a structured program for recovery for long term maintenance of performance. Role of coaches and support staff. We must educate the athletes on injury prevention, and we must create a culture of injury awareness and safety. We have to integrate these prevention strategies into training programs. Return to play consideration. There are several criteria for safe return to sport following an injury, and they should be rigidly followed. Make sure your rehab program has got gradual progression and reconditioning principles. And prior to return to play decisions, make sure the athlete is ready psychologically before you even think of returning him to play. Advances in technology. There has been an increased role of wearable devices for tracking biomechanical data and injury risk. Artificial intelligence is being used for predictive modeling for early injury detection. And virtual reality is being used for rehabilitation and movement training. Challenges. Injury prevention should become a key component of long term athlete success. A multidisciplinary approach, including biomechanics, strength and conditioning, psychology, nutrition, sports medicine, and recovery, is very, very important. Future innovations in injury prevention and athlete safety should focus upon this teamwork approach. Take home message. Injury prevention is a key component of long term athletic success. A multidisciplinary approach incorporating biomechanics, strength training, psychology, nutrition, sports medicine, and recovery is very, very important. And future innovations will focus upon injury prevention and athlete safety. I seem to have finished, ladies and gentlemen. These are my references. Kindly go through them for better understanding. This brings us to the end of lecture 2 of week 8, ladies and gentlemen. Thank you very much for listening and thank you for participating in this program till this time. Thank you and Jai Hind.